It is not very rare for us to start using a medication which is the indication for a different concern in aesthetic practice. So we've used glutathione, we've used minoxidil. Now it is semaglutide. So semaglutide is being abused of late. I've also received a couple of queries with patients asking me to prescribe semaglutide. But in India, it's a totally different game because of this OTC or over the counter. Without prescription, you are getting these medications. But understand that this comes with a lot of side effects or baggage. So firstly, semaglutide is a diabetic medication. It's basically used to bring in better sugar control in patients, and it works by altering the insulin and glucagon levels. These are hormones secreted in your pancreas. So this basically works by increasing the gastric emptying time. That is, the food remains in your stomach for longer, making you not feel hungry for a long time. So this can cause certain side effects, some mild, some severe. For example, the milder ones are diarrhea, vomiting, feeling nauseous all the time, and bloating in the stomach. And you can also get dry eyes sometimes. The more severe side effects are you might end up with severe dehydration and sometimes bad smelling burps. This is also caused because of GERD. Clinical studies have showed that it has caused 20% of weight reduction within 68 weeks of time period, which is why this drug is now being abused. In dermatology, we receive patients who have undergone extreme weight loss with loss of facial fat. We also call it as lipoatrophy. So now this is called as Ozempic face or Wegovy face. So how this is not desirable is suddenly patients end up with depuffing of their face and they may start looking aged or elderly. So how can we repair this is we can of course use something which is going to fill up the skin fat pockets like our age-old fillers. We can also do skin tightening treatments like HIFU or RF skin tightening, or we could also use threads.